Government has welcomed the positive trial of Dexamethasone drug. The drug is produced locally by Aspen Pharmacare. The World Health Organization has welcomed initial clinical trial results, but is advising the drug should only be used under supervision. Well, how's the country planning to use this drug? We're joined by Health Minister Dr. Zweli Mkhize for more on the story. Dr. Mkhize, interestingly enough, I heard you say earlier in the day that South Africa was already using this drug in the treatment of COVID-19, but this finding and this research certainly does guide what you will be doing going forward.
Well, we are very pleased to get the report from the Oxford University about the usefulness of dexamethasone. We are particularly pleased because this is a drug that is not new. It has been used in the past, and it has been in use for many years. It's a drug that we believe, therefore, that once it's been proven that at least 20% of the people who are in intensive care on oxygen and 1/3 of those who are on ventilators have shown an improvement, it will actually assist us a lot as we battle with the COVID-19 situation in our country. I think it came just on time, and so I'm very pleased about that, particularly also because this drug has been around. It's been used in a number of instances where we're dealing with what we call autoimmune phenomena, where the body's reaction is causing damage to its own tissues. And so it's been used in asthma, it's been used in head injuries where there's brain edema, and it's been used in a number of areas. So it's a drug that doctors are fairly familiar with, and they've already been using it, even though it was not part of the protocol. So our teams are now sorting out the protocol to make sure that it's standard everywhere.
Well, it's certainly good to have some kind of silver linings during this period. Minister, I want to draw you to the issue of health workers. It's been raised both in the Western Cape and in the Eastern Cape. There are multiple concerns amongst health workers, but the general impression one gets is that they are undercapacitated, they don't have the necessary equipment to protect themselves, and they're currently being overworked. How are you dealing with these issues?
Well, we take the concern of our health workers very seriously. We are aware that there's a lot of pressure that's been put onto them because of the COVID-19 situation. We have made an undertaking that health workers should be well trained and they should be well protected so that they are very confident as they approach the patients who might be infected or who are potentially infectious. So we have therefore taken all the issues that they've raised quite seriously. We've instructed that in all the provinces there must be occupational health and safety committees with unions where we make sure that the concerns of the staff are taken seriously, and also the issues of PPEs are also checked so that every area must have adequate supply of PPEs, and in addition there must be adequate training so that people are informed. What we have also been picking up are instances where the staff feels that there's not enough information about people who are infected. We want to make sure that all our managers know we don't hide. If somebody is infected, they have to be treated according to the protocols, and there must be a way of ensuring that those who need attention are given attention. And even with our testing protocols, we want to prioritize health workers so that they can be easily identifiable as to whether they need to be taken for isolation or quarantine. So all of this is very, very important for us. And so we are taking those matters quite seriously. We have also we're keeping a record of how many people are infected who are health workers. Right now, we're just close to 2,000 of them who are infected in both public and private, and we keep a track as to how many are recovering and how many need attention, and we always want to make sure that all the health workers know that we really take them as a very top priority because they are the ones who are in the forefront in the fight.
Where do the gaps lie? Because one always gets a different impression when we get answers from you about the situation, and then the reality on the ground seems to be very different. I mean, every other day there seems to be a strike at a different hospital. Today it's Buibatong in Kroonstad. They are complaining about not having enough PPE, and in fact they've had several health workers test positive for COVID-19 too at that facility.
Well, there will always be a gap because it's a huge institution. So what happens is that There's a clear protocol as to what needs to be done. So between every district and within each district and various hospitals, might find that there are PPEs, but the management is not the same. So we will always respond when there's a problem. Sometimes this is why we've actually said the unions must also work with us, because some of the workers are easier to talk to the unions than to the management. Sometimes, therefore, it makes it difficult for management to be sure what the issues are when the members have only raised it to the union. So if we all work together, then we take the issues as they are being raised. Occupational health and safety committees are one of the best ways of pulling all this together. But when there's any concern, we really investigate. But we think that the number of hospitals, they have got different managers. Sometimes we've got enough PPEs, but the distribution is not equitable across the district. Sometimes we've got people who have delayed in ordering. Sometimes we've got people who don't understand what PPEs they should be having and all of that. So we have to take into account that because it's a big institution, things are going to go wrong, and we must just deal with them each time we find something that's gone wrong.
There's been more resources put into the Western and Eastern Cape so far to try and strengthen both provinces in terms of their response to COVID-19. So far, we're not seeing it translate into the rate of infection and the numbers of people that are still testing positive for COVID-19. Why is that?
Well, it's a very interesting question that you should ask, because, you know, it's no longer about what the nurses and the doctors can do. The rate of the spread is depending on the behavior of the community. So as long as we are not able to get people out there to understand the importance of using masks, of wearing masks and hand sanitizers, using distancing and hand washing and all of that, as long as people haven't quite mastered that, you're going to have a problem that the infection continues to grow. And in this case, we are looking at a situation where we have to go out and engage the community. I have been now to these provinces several times. When I spoke to those in the Western Cape, what I'm finding is that there's a challenge in the community that now needs to be convinced to go out for quarantine, for isolation. And that becomes a bit of a challenge. When you come to the Eastern Cape, some of the cultural practices during the funerals might be a factor. So to limit the numbers, and also watching the funerals are being attended by less than 50 people, it's a challenge. And sometimes people don't even report when they have been told they are positive. They kind of are anxious, and so they move away from the area where they are. So you get a number of these issues. We've now involved social workers, psychologists to come on board to help us together with the communities. That's why we had the multi-sectoral ministerial advisory committee, because the issue is now about behavioral change. It's no longer about what the nurses and the doctors can do in the hospital and the clinic.
So Dr. Mkhize, if I understand you correctly, you're saying that the increases that we're seeing right now can largely be attributed to the fact that people are simply not implementing the measures that have been put down in terms of the mask, social distancing, and all the other interventions that government has been speaking about.
Precisely. If I just take you back in the Western Cape, the first outbreak in the Western Cape happened in factories and shops, and this is when we had not started instituting the use of masks and distancing. But now we have actually said that must now be done. We are now finding that the communities are not responding as easily to actually come to join our quarantines and isolation. And so when that happens, it means that we are not able to break the cycle of the infection. So with that, you have to continue persuading the communities, because in some areas they look at someone was COVID-19 positive but is better now, maybe it's not so serious after all. So just to persuade them to leave their homes. Some are fearing because there are challenges of theft of their place, of their goods, and some of them think they might come back and someone would have occupied their place. Those kinds of things are what is coming in as some of the factors we have to now work on.
Now that you've had an opportunity to study the pattern of behavior and to see how South Africans are responding within the eased lockdown, what does it do to the expected peak numbers? Where does it leave us in terms of what you are expecting as the rate of infection when the country does reach its peak? What do those numbers look like now?
Well, it's not easy to give you all those numbers right now, but we do expect that the numbers of people who are dying will increase. We do expect that the numbers of those who are positive will increase, and that the numbers of people who are hospitalized will increase. Now, the issue is depending on how much we are able to ensure, behavioral change, we will then impact on those numbers. So if we've got those people not adhering to the use of masks and containment measures, the numbers can actually go as high as anything. So we're looking at several thousands of people, and like in the next month, you could go up to about the record is that you could actually reach about 7,000 deaths, as it were. So the admissions can in fact overrun some of the existing beds in the hospital beds. So those numbers are variable, but we have to keep working on them. But the key is whether people are able to deal with the containment measures. If they do, the numbers will change. If they don't, then the numbers will go up. We did expect that with the easing of the lockdown, that these outbreaks are going to start increasing. As you will have seen now, it's happening in Gauteng, it's happening in Northwest and Limpopo. A number of those people moved from other provinces into those areas, particularly as the miners were coming back. So those numbers are actually going to start spreading in those particular provinces.